everyone. I am Stephanie with 9 Health. All week we've been talking about organizations that are helping during this time of the coronavirus, how you can help, and some resources for those that need help, and just good tips and information for all of us to use. Today we have advice from Well Advised for people that are over 65, and really things we can all use on how to deal with the coronavirus. I'm joined by Dr. Robert Morris. He is the Chief Medical Officer at Well Advised. And of course, joined by Dr. Kyle Coley, our 9 Health expert. You can ask her some questions about the coronavirus in general. Both of them can really answer any of your questions today that you have about the coronavirus, COVID-19, living our everyday lives. If there's questions you have, I ordered groceries today. I was talking about this with Dr. Morris. Ordered groceries today. They were just dropped on my porch. But then what do I do when they come inside? How much disinfecting do I need to be doing? And I think those are all, we'll talk about some of those tips. I want to mention Well Advised is one of our partners that's stepping up to support our work. They offer free tools to make Medicare and healthcare less confusing. You can go to their website, well-advised.com, and I can put that in the comments. First, Dr. Coley, I want to get an update from you just on the coronavirus today. Give us the latest.
So I have some good news and some bad news to share today. The good news I'll start with first, which is that we had our first randomized controlled trial of the hydroxychloroquine azithromycin combination. Now, we've been hearing about this combination for a couple of weeks now from the president, but it seems we have the first kind of more rigorous data showing that maybe it does shorten the duration of illness and lead to faster clinical recovery. Now, still a very small patient size, about 60 patients or so. So 30 in each arm, 30 got the drug and 30 were sort of the control group. And it seems like those who got the drug seem to do a little better. So that's the good news for today. The bad news, unfortunately, is that we have crossed 1 million cases worldwide, and almost 25% of them are here in the United States. And of course, we've heard about the president's models that the White House has presented that are projecting about 100,000 or so American deaths if all 50 states go on a stay-at-home order through the end of May. And so since that's not quite happening, there could potentially be even more deaths. So I think the worst is unfortunately still yet to come, and we still have to brace for that.
All right, thank you for that. Yeah, good and bad news today. I always like to hear the good news, but yeah, definitely some bad news that has come out today. Dr. Morris, tell us a little bit about, I'm going to talk to you about handling some of those everyday tasks that I kind of mentioned, but first tell us what Well Advised is in general and how you are helping people over 65 during the COVID-19 pandemic.
Well, we're a company that's designed to help elderly people make the sort of crucial decisions we all have to make about our healthcare. And the first thing that we do is we make sure that you're on the best Medicare plan that suits your specific needs. We know how complex Medicare is. We know how to find our way through all the rules and regulations. We know how easy it is just to leave it up to chance and pick up the first plan that you come across. And we know that that's not the best thing for you. So what we do is we ask you a few very simple questions about what you like and dislike about the healthcare you're getting at the moment, about your physician, your hospital, the insurance company you have, and we ask some basic questions about your finance as well. And then behind the scenes, we've got this extremely clever system that takes all that information and matches a specific plan to those preferences. And we can then process that through as an application if you want to take our recommendation. So our service is all about you and what you want. It's free and it's unbiased. So we have connections with all the insurance companies, not just one or two of them in Colorado. What we're doing today for you in view of the coronavirus is the way that we're trying to look at it is we're trying to look at it from your point of view. From my point of view.
There's lots of resources on the website too. Did you want me to share the website now?
Yes, that would be good. Okay. So when you go on our website, the first thing you will come across is you will see a screen which looks at, in a separate section, the facts, the prevention, the action that you can take. There's a fourth section which is designed for parents and grandparents of people who are over the age of 65. So we've got here some information that's very specific to what we think people over the age of 65, whether they're extremely healthy and whether they're all can cope on their own or not. There's advice there that I think all of us can learn from. I've learned a lot putting it together, so I understand the sort of thing. So if we stop at some of them, for instance, Stephanie, if you go up one, two, the very simple thing in the middle there, hand washing. We hear an awful lot about hand washing. If you click on that particular one, what we're trying to explain there, as you go down a little bit, you'll see why is it important and what you should use and some of the techniques that you can do. You probably know, for instance, that when surgeons operate, they wash their hands, they scrub their hands, in fact, for a full 10 minutes before washing them off with water. No one is expecting you to do that, but everyone is saying you need to keep washing your hands. So the question is, well, why? Why do I have to keep washing my hands? The virus, first of all, does not go through your skin, does not enter you through your fingers. What it does do is it gets transferred onto your fingers, and you then touch your face, your mouth, your nose, your eyes, and it can go through any of those particular places.
Yeah, and Dr. Coley was even just asking, or not asking, but saying before we came on, especially for this over 65 group, touching their face, they touch their face maybe more, because Dr. Coley, I'll let you say, you know, why the 65 and over group might be touching their face more. So we really need to reiterate that fact.
Yeah, we had just been chatting about how they might have a hearing aid that they have to adjust, or dentures they have to put in and take out and clean, or eyeglasses that they may have to adjust, and getting to the bathroom to wash their hands, and you know, they may need to use a walker or something else that's also could potentially be contaminated. So it's harder to sort of keep your hands clean and keep your surfaces around you clean.
Yeah, so Dr. Morris, I'll let you continue. I just wanted to bring that up while we were talking.
It's a very good point. And if seniors wear contact lenses, that's another issue that may be a problem for them, where they need adjusting, they have to be taken out and so on and so forth and kept clean. All these things, what we're doing when we wash our hands is we are essentially washing away the virus. We're not killing it necessarily, but we really are washing it away. So the important thing is getting between your fingers, getting underneath rings if you're wearing jewelry on your fingers. And some people advise you to take off rings. I'm not sure that that's really necessary, but certainly you need to keep them clean underneath there. So
someone did just ask on Facebook, can I just use that antibacterial gel all day instead? So if they have, you know, that antibacterial gel around their house and just using that as they're out and about all day.
I don't think antibacterial gel is wrong, but I do think that soap and water is better. And I think soap, there's been a little debate about whether soap and water has to be warm water or hot water. I think it's probably slightly better if it's warm water, because you get more soap suds, and it's easier for the soap suds to get under your nails, between the joints of your fingers and your knuckles and so on. Right. But I would tend to use soap and water if you possibly can, and block soap is fine.
I would completely agree with that, with just one small comment, which is that if your hands are actually visibly soiled, so if you're out in the garden or you got your hands dirty because you're working on your car, then actually the antibacterial gel, the alcohol-based sanitizer, is no longer considered to be effective. And you really do need the soap and water. And so there are circumstances under which it's completely effective, and that is one of those people who are out camping and their hands get dirty. You really do need to get that dirt off. But if you're indoors and your hands are clean, you could maybe use it. But as Dr. Morris said, it's not considered as effective as soap and water in terms of its antiviral activity.
And I think there's one other thing to add to that as well, which is that constant washing of your hands in too hot water is going to make them dry out. It's going to make them sore, and you should probably apply a moisturizer after that. But again, a moisturizer that sprays onto your hand rather than something that you actually have to dip your hands into, so you're not going to spread it. So that's one good example, I think, Stephanie.
Yeah, I think that's great. And then Dr. Coley, I wanted to have you just talk about that, well advised, they handle Medicare. They have a lot of advice on their website for that 65 and older group. Is 65 and older still our highest risk group for contracting the coronavirus and having, the most complications from getting the coronavirus?
I think there are many different high risk groups, and the fatality rate and the complication rate varies in those groups. So it's hard to say that they're necessarily the highest risk group, but they are certainly one of the higher risk groups, and that's been shown over and over again. Some of the other high risk groups are groups that have lung disease, so asthma or COPD, pulmonary hypertension, groups that have heart disease, whether that's coronary artery disease, arrhythmias, heart failure, hypertension. All of those are considered high risk groups. Groups with diabetes or obesity, and then people who are immunocompromised or have suppressed immune function, and pregnant women are also considered a high risk group. And really the way to kind of remember who's high risk is really to try to think about what happens to your body when this virus invades. You mount an immune response, and that can affect your lungs and cause your lungs to fill up with fluid and put stress on your organs and cause your blood pressure to go down, which puts further stress on your organs. So if your organs are not in good shape, so whether you have kidney disease, heart disease, diabetes, hypertension, really any condition that affects you systemically, you can really not do well with this disease. Having said all of that, we are seeing certainly a signal for younger people that are getting into the hospital and potentially also dying from this. And data from the CDC from the United States cohort has actually told us that 38% of people who got into the hospital were under the age of 65, 48% who got into the ICU were under the age of 65, and 1 out of 5 who died were under the age of 65. So still seeing the majority of deaths over 65, 4 out of 5, but you are getting a signal in younger people as well.
Okay, and
one of the questions that came to me independently, Stephanie, was asking about, okay, how do I raise my immunity response, my immune response? What can I do as an older person about that if I think that it needs raising? And the answer is very boring, I'm afraid. The answer is the usual things. It's exercise, not drastically, but any exercise rather than sitting on a couch is better than none. That helps to raise it. It's diet. It's fresh fruit and vegetables. It's keeping that fiber intake up, which you should be in any case as an older person, and avoiding all the constipation that inevitably seems to go with being elderly. And thirdly, it's the sleep that you have, understanding that in fact one needs to have a routine about going to sleep. This applies at any age. We do it to our children. We have an hour of reading in bed before they have to go to sleep, and then they go to sleep. As we get older, we tend to cut this out. And in fact, it's extremely useful as an older person to have a routine about going to bed, about having a time when you know that within 15 to 30 minutes, you are going to go to sleep, and you wind your body down. And that is a way of actually improving your sleep and improving your biorhythms. Those three things, they're not dramatic, but they are very important.
Yeah, all those healthy things we know we need to be doing.
I just wanted to add one thing to what Dr. Morris said. I completely agree with everything in terms of vitamins, because a lot of people have been asking about vitamins and whether they boost immune function. And if you're vitamin deficient, vitamins A, B, C, D, E, and zinc, selenium, and iron are the ones that are involved in immune function. So if you're deficient in any of those, then certainly you may benefit from repleting them. But if you have a well-balanced diet, there's really no evidence that taking mega doses of vitamins can be helpful, and they can actually be harmful. But if you're elderly, you're certainly at higher risk for vitamin deficiency, particularly vitamin D deficiency, because that requires usually sunlight to activate the UV light to activate conversion of the vitamin in your body. So it may be worth giving a call to your doctor if you've had a history of vitamin D deficiency or any other vitamin deficiency, you've had a gastric bypass, or you have any kind of bowel operation in the past, any condition that could predispose you to a vitamin deficiency, whether you need to take some vitamins for your immune function.
I agree. And one of the myths that we may talk about later on is, oh, lemon juice cures it all. No, it doesn't.
I mean, we can go into that now, Dr. Morris, if you'd like. I did have someone ask on Facebook, and this kind of goes with my next question for you about, tips for living our daily lives, our daily routine, how that needs to change to protect us. Someone asked, are gloves effective when grocery shopping or not? I can let you answer that since we were
Yes,
talking about grocery shopping earlier.
I've just come back from picking up grocery. I'm lucky enough to be able to order online from our local Safeway equivalent, I guess it is, in Colorado. And the question is, I get the back of the SUV open and they put the bags in. And what do I do when I get home? How do I handle it? And the answer is with extreme care. I wipe down the back of the car first to make sure that the person who raised it may or may not have been wearing gloves. And I don't want to come into contact with that. I put on gloves myself and I carry the groceries to either my back door or front door or somewhere where it's going to essentially stay outside to begin with. I have new bags that I go to once I've opened the ones I get from the store. I transfer the groceries into that and then before I take them indoors. I'm still not finished then, because when I have the actual packet that's been handled and put inside a shopping bag, I usually clean that with some form of sanitizing wipe, Clorox wipe or something similar that's not going to actually touch the food. And you and I, Stephanie, were talking before we started about, well, what do you do with potatoes when they're loose, and how do you handle those? And I was saying, well, there is advice on both sides of an aisle, if there is an aisle for it, about whether you should just wash them in water or whether you do anything more serious than that. I would just wash them in water and just make sure they're clean as you would normally. So that would be my advice. So take very great care transferring out of a bag into something that hasn't been touched by anyone else. That's
so not necessarily wearing gloves to go.
Not necessarily wearing gloves. No, I don't think so.
Like my husband went, he wore just his regular like knit winter gloves because he figured that was better than not wearing anything. But then you still need to wash your hands because it's just a knit material, and then we need to wash the gloves. And
actually, the one thing you shouldn't wear is woolen knitted gloves, because they.
I mean, it wasn't my husband. Maybe it was someone else. Someone I know.
But you shouldn't. They are actually been shown to carry the virus more than nitrile or other gloves that most people.
Yeah, and maybe we just threw them in the wash right when he came home. But I was like, well, what's the point? You might as well just wash your hands right when you get home. So I mean, maybe it had a.
Well, I think one of the problems about wearing gloves all the time, particularly, is that you get careless with it, and the gloves can carry the virus just as much as anything else, and you can touch your face with gloves on, and it's just as bad as touching your face without gloves. So one has just to remember all the time. To some extent, it's one of the advantages of wearing a mask, and I'm not proposing that one should, but it's a reminder that you shouldn't be touching your face all the time.
Right. And I think to just add to that, if you are going to go shopping without the gloves, make sure you wipe down that cart really well, where you're especially where you're touching it.
Right. Absolutely.
Yeah. And I'm just looking at, we are getting a few comments right now. Dr. Coley, Denise asked, does COVID-19 start with a sore throat? I'll just let you kind of answer a symptom question.
There are some percentage of people that will have sore throat as an early manifestation. It's a minority of patients, under 20%, but it's possible that could be a manifestation of the disease.
And there's a couple of questions about testing. Someone asked about an update on when antibody tests would be widely utilized. Can you answer that question?
The FDA just today actually approved the antibody test for COVID-19, which is, in my opinion, a pretty significant advance, because it'll tell us not just people who are actively infected, like the prior PCR test was telling us, but it will actually tell us people who've had infection, recovered, and developed immunity, which could certainly be important as we decide who needs to continue to socially distance, who can get back to work, and also as we think about therapies, using people who've recovered, using their plasma and transfusing it into people who are infected. So the antibody test has been FDA approved. As far as I know, I'm not sure how widely available it is here in Colorado, but hopefully we're expecting that it will be available in the near future.
Very exciting news.
And then since we were talking about gloves, Dr. Morris, someone asked, could the latex gloves be soaked in bleach and then be reused?
They can be, yes, both inside and out.
So again, just a lot to think about when using gloves.
Right.
I was thinking if we had any other questions that we needed to answer. While we were kind of talking about symptoms and things though too, that someone just brought up the sore throat. The advice we've been given, if you feel any symptoms, feel sick, just call your doctor first. Dr. Morris, wanted to ask you, if you don't have a doctor, don't have insurance, especially if you're over 65, what's your advice for those people?
Oh, a little advert coming up in that case. If you go to Well Advised site, we can help you get Medicare insurance and get a Medicare plan that suits you, as I was saying at the beginning. And that, of course, will help you find the physician that you really need to find. And that can be done very quickly.
And then I had mentioned yesterday during our town hall, we were talking about resources for people as well. If you're not in that Medicare age group, Connect for Health Colorado, they've opened a special enrollment period through the end of the week. So if you need other types of insurance as well, or need to shop for insurance, if you've lost your job, need insurance, you can go to Connect for Health Colorado's website and apply for those benefits there. Let's talk a little bit about rumors and myths. Dr. Morris, I'll let you start since you wanted to bring up some rumors and myths that you've heard, and maybe Dr. Foley can chime in as well. Things you've heard.
I have a list that I'm compiling.
A long list.
Of myths, and it's getting longer and longer. First one I had was, oh, this is a man-made virus made in China, and it's all, this is why we've got it. No, it's not. It's not man-made. It's been proven that this is a natural virus that has just crossed originally from bats through another animal, a lizard-like animal that we luckily don't have much in this country, to humans. So it's not man-made at all. Lemon juice, I think we mentioned as a diet that stops the virus. No, it doesn't. It's good for you as a citrus fruit, good for vitamins and so on, but nothing else. Mosquito bites. No, they don't carry the virus. It's not transmitted through the skin. It's transmitted through your lungs. Very different. Blood donation, we had a session yesterday and Brooke was very clear then about that there is no free test when you go and have a blood transfusion. And no, blood transfusions do not carry the virus, certainly do not infect you. Let's put it like that. The other one I heard was, oh, holding your breath for 10 seconds. If you hold your breath for 10 seconds, your lungs are very good and you don't have any fibrosis and you're okay. No, doesn't mean anything at all. Just means you can hold your breath for 10 seconds. Vodka, this was a good one. If I wash my hands in vodka, is that as good as a sanitizer as anything else? Well, actually, no, it's a waste of vodka because vodka is usually only 40% alcohol and you need something, it's even less than that actually, 40% proof. You need something that's up to 60% and so on. And if anybody has got a 60% vodka that they know about, let me know. It could be interesting. The other thing I think is that virus stays around on surfaces for a month. And Dr. Coley, I'm sure you can say something about this as well. That there is a difference between detecting a virus on a surface and being able to get infected from it. And it seems to me that those distinctions, I've tried to make that clear on the website, those distinctions need to be clear, that yes, you can detect it very often for 9 days, I think is the longest that somebody has detected it for. But the amount of virus, the volume of actual organisms present goes down fairly rapidly. On some surfaces it stays. Plastic and stainless steel are pretty bad, and that's why they need to be cleaned. And some kitchen surfaces may act in the same way as well. Some of the kitchen counters, for instance. But what we do know is that, as I say, that the volume goes down and that the question of whether you can still get infected just because you can detect it is very clear that they're not the same thing.
I think that was all good things to share. I'm going through kind of what we're getting on Facebook as well. And it's more of a, well, there's another hand washing question, and Dr. Morris or Dr. Cole, either of you could probably answer this, and I brought this up the other day, they're not going outside at all. So do they need to be washing their hands as often as if they were going outside, or do they need to keep sterilizing their house? If they're not ever leaving or being exposed to anything outside, I would think not, but I'll let you guys, the experts, kind of answer if they need to keep washing their hands if they're not ever leaving their house. Dr. Coley, maybe I'll let you start with that one.
I mean, there are certain circumstances under which you do need to wash your hands, even if it's not with respect to COVID-19 coming into your home after you use the bathroom, before you touch your face, and before you eat. But besides that, if things are not coming in and out of the house, then you don't need to be going crazy wiping everything down every single day, because really the way the virus is going to get in is, you know, through something that's brought in to your home.
I'd agree.
Yeah. Yeah, I don't know that there's anything else to add to that. Dr. Morris, I don't know if you can answer this or not, and Dr. Coley, maybe you can, but if an individual is over income for Medicare and Medicaid, they don't have any coverage, is testing and hospitalization still covered? So if you don't have insurance for COVID-19, is testing and hospitalization still covered?
So does the person not have Medicare at all?
They said they're over income for Medicare and Medicaid?
No, I don't know what that means. There is no income level, no income
Right.
level for Medicare. So
Maybe they're talking about Medicaid, I
Yeah,
think,
maybe
I
they're
think
just
so,
talking
yes.
about
which is the income qualified plan. Yeah.
So if someone doesn't have insurance, though, they would still need to look into getting some kind of insurance at this time.
yes.
I think testing is covered, right, Dr. Coley? Testing for Dr.
Well, what I
Fauci?
heard on the news the other day was that actually a lot of the insurance companies, President Trump said this, are absorbing the cost of testing, hospitalization, and such for anything coronavirus related. Now, what I don't know is if hospitals are doing the same. In other words, if you don't have insurance and you go to a hospital, are they obligated to take care of you? I would guess the answer is yes, but I don't know that for sure.
I think, Stephanie, that is something, and I agree with that answer. That is something that we will look into, and we will put that on our website as to whether that's available.
Okay, and then just to clarify, Medicare is different than Medicaid. Medicare is you age into it. The Medicaid is, like as Dr. Coley said, the income-based
Yes.
insurance assistance. Okay.
And the way I remember that is that Medicare ends with E, which is for elderly. So that's how I remember that.
That's a good trick. And there's a question on here that Dr. Morris, you could be able to answer. My 76-year-old mother wants to drive this weekend and be with us in Iowa to escape Colorado. Do you think it's safe for her? So to leave her home, go to family in a different state, driving there.
No,
What would your recommendation be?
not go. No, no way. If it was my mother, I would say no. Hard as that is, but is she going to have to pick up gasoline? Is she going to have to stay somewhere? What happens if she has an accident? Why is where was she going to? What state?
It says they were going to Iowa to escape Colorado. So 76-year-old lives here, wants to drive to live with family in Iowa.
My advice would be not to, because Iowa is just as susceptible to coronavirus as Colorado. And I think the risk of traveling there is too much, I think.
I completely agree, because you're stopping along the way, as Dr. Morris said, gas stops, overnight stops. Anytime you're leaving your home, you're exposing yourself. So certainly I wouldn't recommend it either.
I'm just thinking if there's any other questions on our Facebook page that you guys can answer right now. I think we've answered most of them. Again, if you have questions, you can post them. And if I don't get to them, we'll make sure to answer them even after we get off this live. I'm looking through everything we went over, Dr. Morris. I don't know if there's something else that you would like to chat about, any of the advice you had for all of us, but 65 and over, for going through daily life. We talked about grocery shopping. If there was anything else that you wanted to talk about before I let you both of you go here.
Yes, I think that the question of how do you keep in touch with people is one that everyone needs to be aware of. Elderly people now, people of my age, are pretty used to using tablets and telephones. Almost everybody has got a phone of some form or other. And I think it's really, really important that the communication between friends, between relatives, your children, your grandchildren continues and it becomes regular. I think it's actually something that's going to change all of our lives, particularly the way that we talk to each other and the way we communicate. I think it can bring that isolation that we're talking about, people being isolated in their own home and having to communicate through electronic means. I think is actually going to be, in the long run, perhaps a good thing, because we're going to become much better at it. We're going to become more used to it. We're going to become better at looking at opportunities to get together in that sort of particular way that we may not have done before. Children are much more likely now to be called, grandchildren particularly, are much more likely to be calling their grandparents now than they ever were before. They're at home, they're bored, let's call granny, etc. So I think there are some good things that are kind of come out of that. So all of us need to learn how to talk to each other and how to use all the skills we've got to provide each other with some comfort and some hope and for the future.
Yeah, I think that's very well said. And we actually are calling, grandparents, and even if we didn't see them very regularly, we are calling them more than,
of course,
before. So it's a good side effect, like we said the other day, of some of this isolation and things that we're doing and making sure that we're staying in touch. Dr. Clay, I don't know if there's anything else that you want to add before I let you guys go today. There's a couple more questions on here. Someone did just ask about, it was another grocery question, but wiping down, do you need to wipe down like the cans that you're getting? So like any stainless steel surfaces.
I do.
Or aluminum surfaces.
I do, or I get my wife to, yes.
Would it matter if it's in a box? Because I'm trying to think of how long it lives on surfaces. So
no, I'm just thinking about people who are in the store and may load up groceries for you. Are they always wearing gloves? If they're wearing gloves, have they touched their faces? All those sort of questions.
Right.
I would just be safe.
Okay. I think that's good. Is there anything else that you would like to add, Dr. Coley, before I let you guys go today?
No, that's good, I think.
All right, I wanted to let everyone know if you you can post questions in the comments and we can get those answered still. But I also want to let you know to call our 9Health Neighbors line, especially let those neighbors know that don't have internet access or Facebook access. Our 9Health Neighbors line is 303-698-4455, extension 2005. You can call that line, leave a message with any question, health question, but really any question, because we have some non-medical volunteers available as well. And a health professional will call you back within 24 hours and answer your question, talk with you. It's someone to talk to in person, which is also nice right now to just be able to chat with someone over the phone about any of the questions that you have. So give our 9Health Neighbors line a call if you have any medical questions. And again, we're looking for good news stories and other things as well. So you can call that line and leave any kind of message, really. We just want to hear from all of you. I will leave you guys now and we will sign off. And thank you for joining us again.
Thank you.
Thank you.